You're listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our RazorCast studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with Dr. Igor Kaplansky. Dr. Kaplansky is the founder of Dentistry by Dr. Kaplansky in Gasport, New York. He grew up in Russia, and after receiving his dental degree, he was accepted into the International Dentist Program at the University of Buffalo School of Dental Medicine. He graduated cum laude in 1998 with a Doctor of Dental Surgery degree and continued as a resident in the Advanced General Dentistry Program at Buffalo. Since 1999, Dr. Kaplansky has been practicing family dentistry with a special interest in orthodontics and dental implants. He has been recognized with prestigious fellowship awards from the Academy of General Dentistry and the International College of Oral Implantologists. Dr. Kaplansky is widely considered to be one of the top dentists in the country, and he is also a contributing member of our national network of industry professionals. Today we are going to talk about a very important topic, white fillings. Hello, Dr. Kaplansky. How are you today?
Morning, Liz. How are you?
I'm great. Thanks so much for joining us today. So can you start by describing what a cavity is and what causes cavities?
Definitely. Most people probably know by now what causes cavities, but maybe the mechanism is not clear. So we'll go over that. Cavities are caused by a microorganism called Streptococcus mutans. What happens is Strep mutans resides on the tooth structure. Most people have it, but during its life cycle, Strep mutans consumes sugars, and the byproduct of their metabolism is acid. So as they consume sugar that the person eats, mostly refined sugars like candy, stuff like that, they produce acid, and as they sit on the tooth structure, that acid then erodes the enamel on the tooth and makes enamel softer. Then the Strep mutans makes a colony deeper into the tooth, and they produce more acid, and that hole or the cavity grows bigger and bigger and bigger. Eventually they break through the enamel, and the enamel is the hardest structure or substance in the human body. And once they break through that, they get into dentin. Dentin is soft, porous, and it does not provide much resistance to bacteria. So then the cavity spreads extremely fast after that, and it can destroy literally a whole tooth or a large portion of the tooth.
And why do cavities need to be filled, and what can happen if they're not filled?
If cavities are not filled, and the filling is a second step. The first step is removal of the decay. It's not the filling of the cavity that is so important. It's the removal of the decay and the bacteria from the cavity. So first we have to clean out all the necrotic tooth structure and all the dead material and hopefully remove most of the bacteria from there. And then we fill it so that the bacteria cannot live in that space again. And by restoring the shape, the original shape, and the form of the tooth, we make this tooth functional again, because a lot of times cavities can destroy the tooth to the point where it's not even participating in chewing anymore.
And what are white fillings made out of, and why are they better than metal fillings?
Historically, in dentistry, amalgam or silver mercury fillings have been placed for literally hundreds of years. This was considered to be the best material at the time. This was one of the very few materials that we had in dentistry. And silver amalgam had served us well for decades. But then a better material started appearing on the market back in the 60s and 70s, and that's white fillings. White fillings are made of composite resin. What it is a polymer material. It's a plastic, pretty much, filled with inorganic components to make it harder and more wear resistant. And what makes it better than amalgam filling is the fact that, well, obviously it's tooth colored, so it doesn't look black in your teeth. But the main advantage is the fact that white or composite fillings can be bonded to the tooth versus amalgam, which is just filling the void or filling the gap. So by bonding the filling to the tooth, we minimize the amount of bacterial leakage on the side of the filling and prevent future cavities from forming.
If patients have metal fillings, can they get them swapped out for white fillings?
Yes, absolutely. A lot of times it can be easily accomplished if the silver or metal filling is small enough to do that. Unfortunately, a lot of times we see people come to us with very large silver fillings that are 50% or more of the tooth. In that case, replacing a filling with even a larger filling is not a good idea from a just purely mechanical standpoint. It would weaken the tooth and make it prone to fractures. That's why when existing fillings approach half of the tooth or larger, we suggest crowning teeth, which is more predictable and lasts longer. But silver fillings can be replaced with white fillings. We do it all the time.
Great. Now, lastly, what is involved in the process of getting a filling?
Very simple process. We anesthetize the patient, make sure that they're comfortable. Then we remove all the dead tissue from the tooth, from inside the cavity. We remove all the debris, food, bacteria, whatever was trapped in there. Clean it really good. And then we place a bonding agent, which is a material that will act as a link between the tooth and the filling material. And then on top of the bonding agent, we place a filling material. We shape it and give it a nice tooth shape. And then we use a curing light. It's that blue light that patients often ask for what it is. We shine it on the filling, and it hardens the material. And after that, we just have to polish it, make it smooth and shiny, and then the patient is done.
Great. Well, thank you so much, Dr. Kaplansky. We know you are extremely busy, so I just want to thank you for your time and help today.
My pleasure, Liz.
And for our listeners across the country, if you are interested in speaking with Dr. Igor Kaplansky, you can either go online to www.drkaplansky.com, that's drkaplansky.com, or call 716-772-7500 to schedule an appointment. And on behalf of our entire team at RazorCast, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading industry professionals.
You've been listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.